Good morning. I have here in front of me a simple box of salt. As I hold up this box of salt, I ask you to think of the number of times you have been told to put the salt shaker away. Have you also been taught that salt is bad for you? How about how many have stopped using the salt for fear of what it is causing, the damage it is causing to your body? The subject that I want to talk to you about today is of great interest to me, and hopefully it is of great interest to you. And that subject is salt, which has caused a lot of controversy in today's society. While it is true that salt can be harmful to the body, research let us know that we cannot function without it. For such a simple substance, common table salt has a very complex past. Once scarce, salt was as precious as gold. Early humans recognized salt as a necessary part of their diets, and because of that, it was an item worth fighting for them. That's because salt is an important nutrient and a very versatile ingredient. Salt is described as a dietary mineral composed primarily of sodium chloride, which is essential for animal life, but it is toxic to land plants. Chloride and sodium, the two major components of salt, are necessary for the survival of all known living creatures, including humans. Salt is involved in regulating blood, the balance of the body, and pressures. When one is craving for salt, it's usually because it's a trace mineral deficiency or there's a deficiency in sodium chloride. The sodium contained in salt is an essential nutrient that allows an organism to maintain its ionic balance and to retain water to keep hydrated. Without salt, one would dehydrate. Salt helps to regulate the volume of the blood and blood pressure. I know that you've heard just the opposite about salt. And because of what you've heard, some of you have decided not to use salt. But various studies have confirmed that the importance of salt in our diet cannot be overstated. Without salt, our bodies cannot perform some of the vital functions, such as regulating blood pressures and body fluids, and maintaining nerve signals. If the body does not get enough salt, it will result in a salt deficiency, which can lead to muscular weakness, cramps, and exhaustion. Severe salt deficiency can even prove fatal. Salt sets off an osmosis movement in the body, and it adjusts the amount of fluids within and outside the cells. A healthy body processes the amount of salt it needs, and it expels the rest through the kidney. At odds with this concept about salt are various physicians and scientists who keep salt in the news by debating its role in a healthy diet. Scientists suspicious about salt are not new, says Dr. Jeffrey Cutler, who is the director of the Clinical Application and Prevention Program of the National Heart, Lung, and Blood Institute. Cutler estimates that persistent high blood pressure, normally defined as readings of 140/90, is affecting nearly 50 million Americans. However, Cutler believes that the people who are at greatest risk for hypertension are those with a family history, and not necessarily those who have salt intake. Additionally, the Journal of the American Medical Association published a study in its May 1998 issue that suggested restricting dietary sodium intake had only a minimum effect on blood pressures. The authors also concluded that for younger people with normal blood pressure, a diet high in salt is harmless. Some scientists and food writers believe that the importance of salt has been diminished because of conclusive evidence. They point out that inner salt, a significant 1988 global study on salt consumption and high blood pressure with more than 10,000 participants did not prove a link between high blood pressure and salt consumption in healthy people, though it did show that the abuse of salt consumption could lead to the possibility of hypertension. Dr. David Breinstein, a medical doctor, a family physician, and the author of 6 books, including Salt Your Way to Health, he states that salt has become a convenient boogeyman to some groups. Dr. Breinstein said when he was practicing conventional medicine, he would routinely tell his patients to avoid using salt and encourage them to go on a low-salt diet in order to keep them from lowering their blood pressures. He goes on to say that it rarely worked. In fact, lowering the blood pressure or lowering the salt did nothing or rarely did anything to lower the blood pressure of the patients. He said the patients became very grumpy because their food had lost all its taste and it did nothing or very little with the pressure. Research has proven that only a few select salt-sensitive individuals can lower their blood pressure by eliminating or lowering salt in their diet. Breinstein found the patients with hypertension very, very difficult to treat. It was hard to get them off their hypertension medicines, he says. Furthermore, the majority of the patients had lower mineral levels and an acidic pH. As he searched for the causes of why illnesses were occurring, he found that nearly all of them were salt deficient. He came to this conclusion by routinely checking blood work in his patients, and the majority of them had a lower level, below 140 sodium on their report. The last thing I want to share with you this morning is that salt is vital important for a healthy pregnancy. At the Salt and Pregnancy Forum of May 2006, Dr. Marcus G. Mohab published a case study showing that an additional salt intake of 20 grams stopped hypertension during pregnancy. In this case, a 33-year-old woman with normal activity had been diagnosed with hypertension 15 years earlier. During the 6-month period before her conception, her blood pressure was checked and controlled with medicine. Throughout her pregnancy, blood pressure recordings were collected daily. And at 5 weeks of gestation in her first pregnancy, she stopped taking all of her blood pressure medicine. Of course, this caused her blood pressure to increase. She was given a supplement of 20 grams of sodium chloride per day throughout her pregnancy, which resulted in a decrease of the blood pressure during pregnancy. This study led researchers to supplement salt in this woman and others with the same symptoms. More importantly, the researchers have seen one case where salt supplementation has caused negative effects. Salt is important for normal body functions. Salt facilitates digestion. It helps maintain the correct level of body fluids. It allows the transmission of nerve impulses. It enables muscular activity. And it offsets the losses of water caused by excessive sweating. All that I've said today should make you think twice about not using salt. It can best be summarized by using the words of Alicia Stolberg, a research nutritionist at Northwestern University Medical School in Chicago. She's also a spokesperson for the American Dietetic Association. And Alicia says, you cannot live without salt. Thank you.